Stepped up efforts to combat fentanyl trafficking. Opioid abuse remains a public health crisis here in the United States. The National Institute on Drug Abuse reports that more than 130 people in the U.S. die every day after overdosing on opioids, including fentanyl. The Centers for Disease Control and Prevention estimates that the total economic burden of prescription opioid misuse here is $78.5 billion a year, and that includes the costs of health care, lost productivity, addiction treatment, and criminal justice involvement. Now, joining me from New York City via Skype is Andrew Kolodny. He is the co-director of Opioid Policy Research at Brandeis University. Is there anywhere else in the world that has been gripped by the opioid epidemic, or is it really centered here in the United States?
Canada and Australia have also been affected by opioids, but there is no other country that really comes close to the United States. We are experiencing a severe epidemic of opioid addiction, and most of these deaths are occurring in people who became addicted to opioids by taking prescription opioids, the type of opioids prescribed by doctors.
Do you feel that the demand in the U.S. and other parts of the world, as you mentioned, is lessening or getting worse?
So the opioid addiction epidemic in the United States was really caused by massive overprescribing of opioids. And so as doctors in the United States began to prescribe very aggressively, millions of Americans became addicted. Both patients became addicted to their own medicines, but as it was overprescribed, it wound up in many people's homes where family members could become addicted. Over the past few years, the prescribing has started to trend in a more cautious direction, which means the number of new cases of opioid addiction may be declining, but millions are now suffering from the disease of opioid addiction, and they need access to effective treatment. And despite the recent decline in opioid prescribing, there is still no other country on earth that comes close to prescribing opioids as aggressively as we are in the United States, which means many people are still getting addicted.
Dr. Kolodny, I want to get your reaction to these recent court cases, a landmark ruling against Johnson & Johnson in the state of Oklahoma. We're talking billions of other dollars when you take other companies into account as well. What is your take on what is happening, and what is this signal?
Well, this ruling from an Oklahoma judge against Johnson & Johnson for $572 million to the state of Oklahoma, which is a state with a relatively small population. The ruling from the judge was that Johnson & Johnson and other pharmaceutical companies are largely responsible for this epidemic of opioid addiction. What the court found was that Johnson & Johnson participated in a multifaceted campaign that deceived the medical community about opioid risks, especially the risk of addiction, and encouraged inappropriate prescribing. And so we are now seeing many states across the country filing similar lawsuits against opioid manufacturers and distributors to hold them responsible for this epidemic.
We have about 30 seconds left. Want to get your take on other countries. U.S. President Donald Trump accusing other countries of contributing to the flow of fentanyl to the United States. Is it more than just rummaging through packages and mail to try to, attack this issue?
Yes, it is a lot more. So because so many Americans are opioid addicted, there's tremendous demand now in the United States for opioids, both prescription opioids, but illicitly synthesized opioids as well. And so much of the opioids, the heroin or the fentanyl that's coming into the United States is coming in to meet demand for it by people who became addicted. One of the more effective ways to really tackle this problem is to see that people who are addicted have access to effective treatment. If they were able to access treatment more easily, I think there'd be less demand for illicit fentanyl, which is extremely dangerous.
All right, Dr. Andrew Kolodny, thank you so much for joining us from New York. And